Happy Super Bowl Monday, world. It is Monday and we are super excited, just like the Super Bowl in America, because we've got a special guest on show today. To my left is none other than Tom Cartwright from Cartwright Physical Therapy. He is our back and spine guru. He's an amazing practitioner and we've worked with him for a long time. To my right is my brother Rad. He is just all-round amazing. The list is too long and distinguished to go into. But we are going to be talking about spinal injury management today, and we're also going to be answering a couple of very specific questions that have come in over the weekend. All that and more coming up right after this. We are the gym that teaches people how to move instead of just exercise, because we believe that health is about performance, not just body image. All right, we're back. So, first of all, I'll start off with you, Rad. How are you feeling today?
Awesome. Yeah, had a great weekend. Good weekend with my family, and a good weekend of training, and pumped for a new week. Strength cycle this week, so really looking forward to that, because that means it's deload week next week.
Absolutely, and only 3 to 5 repetitions in our program this week, which is so much easier than 10.
Yeah,
so
I'm choosing progressions that I'm going to do 3 this week. So that does mean I'm going to have to do 8 or 9 sets of everything to get my volume, but that's all right.
Yep, good. Absolutely, absolutely. And Tom, how you feeling, mate?
Good, guys. Thanks for the wonderful introduction. I'm humbled to be in the presence of greatness. As you know, I love your work, and it's just good to catch up as well and see you guys.
It's good, isn't it? We haven't seen much of each other this year.
We haven't. We've both been busy, or each of us have been busy, and it's just good to catch up as mates as well.
Absolutely.
It's important.
Absolutely.
So thank you very much for having me.
Oh,
I love coming here.
Thanks for coming. Short notice. We called Tom like an hour and a half ago and said, Tom, we need some chiropractor's advice. Come in.
Literally, we after the back show that we did last week, and as I said, we are certainly not back specialists. You know, we're personal trainers, and we love to give as much advice and support as we can, because both Rad and I have suffered pretty good spinal injuries before, and we've managed to sort of rehab ourselves. But our advice is sort of limited to our own experience and the experience we've had with our clients. Whereas Tom, on the other hand, is a practitioner. He's a practicing chiropractor, physical therapist, an amazing ART, Grafton. Let's list a few more. Grafton. You're using laser now down at your clinic.
Yep.
Dry needling.
Yeah, like, my God, it goes on.
Taping.
Yeah, everything. He's just very, very good. Counselling, yeah, that's right. And so when we get questions that come in, like over the weekend, that you know could use the help of a practitioner, we are honoured to have built a great network of people around us who we can sort of lean on. And I called Tom up just to get a little bit of insight on a few of the questions that I was typing to you guys, and he was like, man, I can come on the show this morning, let's do it. And I was like, brilliant. So we'll dive straight in, because we've got a couple of really, really good questions here. And the first one is from Dr. Phil.
Sorry, I got a hair in my throat. Dr. Phil has said, I've suffered with spondylolisthesis for 30 years.
I love that. Hang on, just quickly. I love this profile too. He has quite literally got a picture of Dr. Phil.
Yep.
Yeah, have a look at this. You can't really see it there.
Yeah, see it.
So just in case we're talking to the real Dr. Phil, good show.
Yeah. So tried everything and studied all sorts of therapies, always avoided squats and deadlifts, as I assumed it would make things worse. Recently saw a video on YouTube where a French guy said he cured his grade 4 with these very exercises. Recently started doing 100 deep squats. 100, I'm presuming that's a weight. So
no, it's a rep. It's a rep, because he says with no weight.
Okay, 100 deep squats with no weights, and are surprised it hasn't aggravated the injury. The doctors say no vertical weight should go on the spondy, but I do shoulder presses with no trouble. I now have prostate cancer, and I suspect it is because of the years of inflammation. Well, this is a big question. Just sitting on a plane kills me, so I understand the misery lower back injuries cause.
Just quickly, so this is actually, spondylolisthesis is the same issue that Rad has. It's also referred to as a pars defect, or in severe cases a pars fracture. And there's a couple of different reasons, to my knowledge, why it occurs. One is where the pars, what's it called? The pars
interarticularis.
Articularis, that's right.
It's a small joint
Fractures,
at the back of the spine.
So the way that the spine sort of works is the pars anticularis, they sort of link together as like a chain almost, sort of, to hold the spine in place.
That's a good analogy.
Yeah.
They're just links all the way up and down the spine.
That's right. And when... you can correct me if I'm wrong. Usually it's due to a fracture, like a pars fracture, like what Rads suffered, where the articularis will sever and then the spine can start to move out of place. But it does also occur in old age from wear and tear. Is that right? Or
that's true. I think probably rewind a bit, just for your audience. It helps to understand. First of all, the condition, it's spondylolisthesis. So spondylo is Latin for vertebra, and listhesis basically is Latin for anterior slippage or forward slippage of. So in the scenario where you've got vertebrae stacked up on top of each other, it's the case where a vertebra will move forward relative to the one below it, and it takes the spine with it. So all the bits above it shifts forward as well.
Yep.
There's five, 6, 7, depending on what sort of sources of information you read, 5 reasons as to why, or five causes. You're testing my memory here, but I think the first one is dysplastic. That's where the pars interarticularis, let's just call it the part of the vertebrae in question, it kind of stretches out. It doesn't form correctly. Then you've got isthmic, which is hard to pronounce, and that is the fracture that you're talking about, and that's what I think you might have, Rad. You've either got isthmic, which is a fracture from a young age, and the symptoms usually haunt you later in life, like in adolescence or later in adult life, usually because you've lived so long and you've put yourself under so much pressure that it only manifests later in life. You might also have congenital. I'm not quite sure. So congenital means basically from birth.
Yeah.
You're just born with it that way.
Yeah.
Then there's degenerative, which is basically means arthritis. So as we get older, we kind of wear out and we break down a bit. And then you've got traumatic, which is like a severe accident. So you could sort of bottle traumatic in with isthmic if you want, and then that's 5. I think the 6th one is pathological, so it could be through a tumour or cancer or some sort of metastasis that spread to the spine and then it breaks. But the point to be made with spondylolisthesis is that there might be many people out there who have this but don't even realise, and it's because the body, being such an amazing machine, is able to adapt just like you have, Rad. I mean, you probably get occasional back pain, yeah, but because you're probably a prime example of somebody who has worked on their core and explored movement to the nth degree such that it doesn't really bother you.
Yeah.
You might have occasional flare-ups, and that's probably more so because you've redlined your body than from neglect.
It actually usually happens when I don't exercise. If I don't train for a few days, I get uncomfortable. If I don't train for a week, I am in pain.
Well, that's interesting. So maybe that means that your core, relative to the way it usually is a little retarded.
Yeah.
Meaning slow.
Yeah.
Because I know you're retarded as well.
Yeah.
Hey, everyone knows that, mate. Like,
No, jokes aside. So I think with Dr. Phil, and I should add, if Dr. Phil does get in touch with me, I've just increased my rates. Just for you, Dr. Phil.
Of course, we're referring to Dr. Phil on television. Yeah.
I think he's saying that he doesn't feel any pain when he does 100 squats weightless.
Yep.
That doesn't surprise me, because you should be able to squat your own body weight even with that condition, assuming that it's not super bad. I mean, and that's the other difficulty here, is we don't have the person in front of us, and I'm not sure how old you are, Dr. Phil, and what your full history is, but it doesn't surprise me that you can do a full squat, butt to the ground without any pain 100 times. But there certainly probably would be a limit where, if it was 100 kilos 100 times, it's going to blow out. you know, possibly a front squat, a weighted front squat is better than a weighted back squat.
Yeah.
You kind of have to play every ball on its merits,
Yeah.
and get the person in front of you and say, okay, well, what can you do and what can't you do?
My experience, having suffered this condition myself, is that if I lift so much weight that my pelvis goes out of alignment and my core doesn't stabilize itself, so it puts even more pressure on that joint, that's when I'm in trouble. But if I lift a kind of weight that I can really brace myself properly and keep my pelvis in the right position, then there's no problem at all.
Yeah.
I mean, you're probably the best one to talk about it here, from a real life perspective. And I was thinking about this. It's having a spondy is not such a terrible condition to work with. I think a warning sign is, you know, if you go to massage for relief from the lower back pain that you might be suffering from spondylolisthesis, you need to be careful about people pushing direct pressure onto that forward slipped vertebra, because just commonsensically it doesn't make any sense to push down on something that's already been pushed forward. Either side is okay, but I'm getting at you know, that style of massage where people walk on you, you know, with the rails and stuff like that. And that might be fine and tolerable for some people, but not probably for Dr. Phil.
Yeah.
I think, you know, the general consensus is with spondies you need to work on abdominal strength, because your spine is not, it doesn't have its full integrity. So you need to use the other structures around, which is muscles. It's like having a labral tear on your hip or your shoulder. You know, that level of defense is blown. So you need to build up the muscles.
Yeah.
Spondy is a classic example where active care becomes the focus.
Yeah, that's right. So the take home, Dr. Phil, for you is absolutely I'll talk to you here straight away. The take home for you, mate, is absolutely strengthen. Like focus on what Rad does, and you reach out to Rad because he has been working on this on a personal level for quite some time, and it's probably a better conversation for you guys to have offline. But work on strengthening the abs and glutes, and you absolutely do need to work on it, otherwise it won't get any better.
Probably just to add one more thing as well. Decompression-based exercises would be very useful.
That's like gold. Just hanging.
Yeah, hanging or
hanging should be like daily medicine.
Using a back block. If Dr. Phil wants to get in touch, you know, you can send an email through Rad Uyani or myself for my practice. And
how can he? What's your email address, just quickly?
If you Google Cartwright Physical Therapy, my practice will come up. You can get in touch with me through there, or type in Tom Cartwright Chiropractor. You'll be able to find me through that way, and I can email him or anybody a list of very easy to do spinal decompression exercises.
Awesome.
Yeah.
Yeah. I actually think that's a great opportunity for us to do a collaboration. We've been talking about this for a while, whether we come down and film it at your practice, which is probably a better idea, and we'll go through that and do those. Remember we spoke about this?
If you can't find Tom that way either, he's pretty easy to find on Grindr. So, sorry, I couldn't hold that in.
You just had to get it out.
I just couldn't hold it.
All right, now
let's get on to the next one.
Let's get on to the next question. Yeah, so we're going to melt because we don't have air conditioning in this room just yet.
Hi Yanni and Rad, I have a question about this topic. I have 4 torn ligaments across the sacroiliac crest and was told I would end up paralyzed when the ligaments stretch during pregnancy. If I were to ever have children, needless to say, that put me off having any. So my question, is this good for me? Do you have any advice? I am following the information in the Vital SOAS book. What do you think? So what was she talking about?
This question was from Rachel. Now, the first one, I responded to you, Rachel, via the message there, and we need a little bit more clarification, because I reached out to Tom because I was a little bit confused, and to my knowledge, there's no ligaments at on the iliac crest.
No, it's the sacroiliac crest.
Oh, the sacroiliac crest. Okay, that changes things up a little bit.
If I can interject, first off by saying, Rachel, I'm sorry to hear you going through this. It sounds like some tough news to bear, but what you're asking is a loaded question, and I just wonder if maybe you don't quite have the full understanding as to what's going on in your body, and I hope you don't take offense to me saying that, but it raises an important issue, because sometimes the practitioners or the doctors who we're consulting with and getting information from, sometimes the doctors, their strength may not be in communicating the real issue to the patient.
Yep.
And sometimes it's the other way around. The patient won't grasp that information despite how well or poorly it's being communicated. And what you say is true. Like, I'm not aware of any ligaments around the iliac crest. I suspect maybe you're talking about the sacroiliac joint. There's a left and a right. In other words, where your sacrum joins to the two ilium bones. And there's a number of ligaments that are around there. That's basically your pelvis. Your pelvis is like a bucket, but it's a bucket that's been made with 3 massive bones, and they need to be stitched together or taped together with bandages, those being ligaments.
Yep.
So if that's what you're talking about, that probably makes a bit more sense, and I understand there's a lot of stretching and stuff that goes on during pregnancy. What did she say? What's the nature of the injury? Is it from pregnancy, or
she says she's got 4 torn ligaments across the sacroiliac crest and was told that I would end up paralysed when the ligaments stretch during pregnancy.
Well,
so she's not describing the mechanism of injury.
I think we should assume that she's referring to the sacroiliac joint, not crest. That's
either way, we need more information.
Yeah.
I wouldn't feel comfortable advising you until I knew exactly what was going on.
Yeah.
I'd like to know which ligaments these are that she's talking about, where they are exactly, and what the nature of the cause was. But she talks about being paralysed.
This is one thing we can certainly comment on. Paralysis only occurs when there's damage to the spine, right?
Yeah, I mean, I can't think of anything else. I mean, you've got your brain which sits inside your skull, and it spits out a spinal cord which travels down your vertebral canal, and at each level it distributes nerves that control your arms and legs and organs and all things like that. If there's ever disruption to the spinal cord, you'll end up in a chair, you get paralysed. But tearing ligaments doesn't result in paralysis unless it's coupled with massive trauma that projects through to the spinal cord.
Yeah.
Or you might have local paralysis of a nerve or something like that. But
so that might be another.
It's kind of very uncommon.
Yeah, that might be another really good one to reach out directly to Tom, and he can probably advise you more with a bit more background, Rachel, on how the injury occurred.
That's why we need how the injury occurred.
Yeah, that's right.
How did it happen?
And I'm sure he's a great guy. I'm sure he will be happy to give you some advice and respond. So. If you dive into, we titled Cartwright Physical Therapy, search him on Google, you'll find his practice. It's blue and white, the logo. It'll have lovely pictures of Tom there. He's it's a distinct look. And reach out to him through the website and he'll be able to help you more. Hope that's help.
All right, now moving on to AB is the name here.
AB.
Hope I'm getting that right.
AB, yep, that's right.
So, hi guys, my Fitness First PT told me the reason why to arch your back, say when doing squats, is because it is highly improbable that a disc vertebra would slip inwards, in other words towards your stomach, and that almost all the time if a disc would move, it is outwards. Rad mentioned in the video as well, but based on the email bullet points from Sarah, arching is not recommended. Do I understand correctly? For me, arching does not feel all that natural. So all I'll say is for those of you that don't know what we're talking about here, he's talking about arching the back like that when you squat.
Forming a concave curve in your lumbar spine.
There is a good, this is again, you might be misunderstanding what your PT is saying. If you might have a really good PT and you're misinterpreting the information, or you might also not have a very good PT and they're not giving you great advice. But one of the biggest problems that people have when they squat is often they round their back like that, and that's really, really bad. So as personal trainers, we often cue people to go into an arch because they don't actually go into an arch, but trying to go into an arch straightens them up a bit. And that's what I've got to say on that.
Let me clarify very quickly. What Rad's saying is true and false. Excessive rounding of the spine where we tuck the pelvis in is not that good when you're moving, but it's actually okay for a brace mechanism, and it really depends on the level that you're doing that. I mean, I know guys who squat hundreds and hundreds of kilos, and that's what they do. They brace by tucking the bum in a tiny little bit, create that intra-abdominal pressure on the abdominal wall, and that's how they're able to stabilize the spine. And what Sarah Key has highlighted in a lot of her sort of, I guess, collaboration and research recently, I don't know how much of the research she's doing herself, but she's certainly got a lot of hands-on practical experience. She's suggesting that that's the better way to do it, and Tom can certainly elaborate on this because he spent some time with Sarah recently while she was in Australia, in Sydney. What's your take on this?
Well, AB, I think your trainers, I mean, his trainer's obviously trying to do him a service, so kudos to him for that. And you're correct, or the trainer is correct in saying that it's unlikely that there will be anterior slippage of a disc or anterior bulging inwards, I think was the word used. Discs tend to protrude, herniate, prolapse, whatever word we want to use, posteriorly. So they bulge out towards the back of our back. They don't bulge towards the stomach. It's just the nature of the way the spine is built. We've got a really fat ligament on the front of our spine which holds it in very well. But at the back, because we have to spit nerves out, there need to be periodic breaks in the posterior longitudinal ligament to allow the nerves to come out, and that's where the disc sometimes tries to pop out. But the first thing that should be said is discs don't slip. It's vernacular. And I've seen these in wet labs, how discs are. They're an extremely strong structure, and they would ooze more than they would slip. Yeah. But in anybody's spine, in all three of us, we probably have bulges. Bulges are normal. It's probably more abnormal to MRI somebody's spine and find that there are no bulges.
Yeah.
And this is another misconception amongst the general public, that, oh, I've got a bulge, that must be the reason for my leg pain or my sciatic pain. The presence of a bulge does not explain necessarily the reasons for leg pain, which is to do with sciatica. Yeah. All three of us could have MRIs. We'd all have bulges. You'd have leg pain, but Rad and I don't. Yeah, in the same level. How do you explain that?
To cast some light on that, I had a spine injury when I was squatting a few years ago, and I had an MRI, and I had 3 disc bulges undiagnosed, and none of them were anywhere related to the issue that I was having. So yeah, it's as you said, it's so common.
So that's a bit of background info. Now, what was the question? Because I tend to ramble a bit.
Yeah, that's all right.
What should I do?
He's basically asking whether is he right to assume that what his trainer's telling him to do, which is to arch the back, is correct or not?
Well, yeah. So I've looked up some work that Sarah Key, a physiotherapist here in Sydney. She's almost retired now, and she's very much all for rounding the back and decompressing the spine. And there's also a lot of trainers and other thoughts out there that when we squat or do loaded back squats and front squats, that we should arch our back, keeping that lumbar lordosis very, very well formed to protect our spine and our discs and things like that. But then if you just watch the powerlifters of the world, the people who are lifting the most amounts of weight, that kind of, to some degree, it kind of has to be gospel, because how do you lift that amount of weight without using the best means to do so?
Yeah.
And when you watch them deadlift or you watch them squat, there is an element of rounding of the back at some point. Everybody, if you squat low enough, there'll be a bit of that bum wink where you tuck the butt right at the end, and there's. The jury's not quite out on either method, and I'm still trying to understand the research and get my head around it. But the argument for rounding the back has to do with how you preload the spinal ligaments. When you round your back, you actually exercise a lot of the strength of the ligaments in supporting yourself with the weight. When you go like this, to some degree, you inhibit the most amount of strength in the structure. So I think, it would be interesting just to take all the mirrors away and just have somebody squat in front of you and just watch what their body does naturally, and then just continue to load them up and see how their body responds.
Yeah.
Some people will be able to do more than others, and that's because of their size, or it'll be because of how little or a lot they've trained. Again, you have to play every ball on its merits. So you just have to hope, AB, that your trainer is experienced, and when you're squatting, that you're not feeling too much discomfort or pain. You might have to experiment with the width apart of your feet, the angle at which you turn your feet out to accommodate your hips, all these sort of things which we probably don't have time to go into. But
squatting is a very personal practice, and it really there's so many different variables that can change the way a squat dynamic affects the body. What Tom's talking about there, the length of the femur and the tibia and fibula in relation to the length of your spine plays a huge role. There's also differences in the pitch of the acetibular in the pelvis, so where the greater trochanter plugs into the pelvis, the pitch of that joint is called the acetibular, right?
Acetabulum.
Acetabulum.
That's the socket.
That can actually change angle, and that completely changes the way that your mechanics
and men and women
work.
will be different too.
That's exactly right.
But we should, because there might be a lot of backlash to what we've said here. All three of us are also somewhat up to speed with Stuart McGill's work, who might seem at first a little in opposition to what Sarah Key says. But I reckon if you rounded everybody up in the room, you'd probably find that we've all consulted the same research. One of the people who's been instrumental in spinal biomechanics research is a person by the name of Bogduk, and it's old research, but it's just the fact that it's old doesn't mean that it's not good research. It's kind of been like, well, look, this is the way it is, and there's no point researching this anymore because it's been shown that this is how the spine works. Yeah. So some people will say, oh, Stuart McGill says this, but Sarah Key says this, and you're saying that. You need to take, that's what I've tried to do. I've looked at Stuart McGill's work and Sarah Key's work, and I've taken it on board, and then when a patient comes and sees me, I play that ball on its own merits.
Yeah, that's right.
That's exactly what we do.
As what you guys do.
Yeah, and I think what so many people get wrong themselves is the value in personal exploration and figuring out what works for your own body, and doing that progressively without an ego. Because that's just where that's where so many problems come in to this, and so many people get really bad back problems, is that they're always looking for what everybody else is doing and trying to figure out how they can keep up or how they can compare, rather than seeing what feels good for them. Doing exactly what you said. So read a bit of this, read a bit of that, watch a bit of that, play around with it. Oh, that feels good. Let's explore that a bit more.
That's a really good point. Right?
And I know for myself, I've been somebody that's had bad back problems. We spoke about that earlier in the show. And I've also been able to squat a lot of weight compared to the average person. I've squatted double body weight, which is 170 kilos for me. And I don't go close to that anymore because, in all honesty, for me, in what I do, I don't see the value in it, like the risk versus the gain. For me personally, I got to that point and I thought, well, where do I go from here? And going forward looked risky to me. And I just went, no, I don't need it. You know,
I think the take-home message from what you've said there is, ask yourself, do the risks outweigh the benefits?
Yeah, that's right.
Yeah, absolutely.
That's exactly right.
Absolutely. Just to create a bit of clarity around what we're saying too, hands down the most important thing, which Rad did allude to there a little bit, is not to lift with your ego. And the majority of the problems that occur from people lifting heavy is because they weren't ready for it. And when you see, like Tom talking about power lifters lifting really heavy, like 400 or 500 kilos, they are rounding and compressing to lock down their abdominal wall and brace and all of that. Now, they've worked extremely hard to build up to those weights, and it's taken a lot of time. And during that process, the multifidus and all of those muscles that we sort of frame as the core muscles have had time to hypertrophy. Yeah. They've had time to build very strong neural pathways to the brain. So the moment that person braces and takes the weight, everything's working correctly the way it should be. And those sort of things take time. Those mechanisms take time to train in the body. So if you come out of being very sedentary, sitting down with a posterior tilt in the pelvis, you've got very poor connection from brain to multifidus to TA to all of the muscles that need to be operating to support you, and you go and try and replicate what these guys are doing, you are going to injure yourself. Yeah. So, you know, there's a few things that you need to do. You need to remove the resistance in the body by making sure that the joints are operating correctly, and if they're not, then you only squat to your active range of motion, you know, movement. You can't deep squat if you're locked up and messed up, you know. And then you can't lift heavy if you haven't conditioned your body to lift heavy, and that takes time. Like there's no fast track to that. You can't rush it, you know.
If you come from a deconditioned background, you're looking at 2 to 3 years of consistent dedicated training.
Yeah,
I reckon.
Yeah.
To be able to get to that point where you can really start squatting and deadlifting some good weight without, you know, injuring yourself. We are going to have to wrap this up real quick because Tom's got to get back. He's got a patient. So thanks.
What is the time?
It's 9:24 and he's got a patient at 9:30.
Right. Yeah,
so
let's go.
Thanks for having me, guys.
Mate, thanks so much, Tom.
Very eloquently put by
Absolutely,
both of you.
Yeah.
I love
Thank
speaking
you,
to you guys.
Yeah.
It's great fun.
We'll get Tom, if you like that, we'll get Tom on more, and we will do the collaboration and get you guys some really practical guide to managing back pain because he's a master at this stuff. And I'm going to get killed for this. Go the Patriots. Tom Brady, bring it home. Woo! Super Bowl Monday, everybody. See you tomorrow morning. Take care. We are the gym that teaches people how to move instead of just exercise because we believe that health is about performance, not just body image.